So cryotherapy. And no, I'm not talking about ice baths. I'm talking about medical cryotherapy. So what is this? This is when we use a very cold chemical, in this case liquid nitrogen, in order to purposefully damage skin in order to heal certain skin lesions. Skin lesions that work very well with cryotherapy are things like post-inflammatory hyperpigmentation, actinic keratoses, solar keratoses, seborrheic keratoses, warts, verrucas, and even some cancers. Things like basal cell carcinomas can be dealt with using cryotherapy. With cancer, it should always be under the expert supervision of a consultant dermatologist. The way it works is, unsurprisingly, by freezing. Inside every single cell, there is a certain amount of water. When you freeze water, it turns into ice, and ice takes up a bigger volume than water does. So by turning things into ice, you can make that water expand inside of the cell. In this case, it's too big for the cell, and this causes the cell to lyse or to split apart or break open. So it is a form of damage on purpose. Today, we are doing what's called a cryotherapy treatment for a lovely patient whose concern is this area right over here. You can see a dark mark on the skin. So we've gone for a bit of a history. This originally started as a spot or a pimple, and that resolved, but the post-inflammatory hyperpigmentation reaction that you can see over here has caused this little dark lesion to turn up on the face. This is an excellent target for something like cryotherapy, which involves damaging the skin on purpose in order to destroy certain skin cells. And in this case, we're trying to destroy the melanin in that area so that we restore normal skin color and a smooth complexion in that area. Cryotherapy is usually not too painful. It just feels a bit more cold, maybe a slight sting, but it is a form of damaging the skin, which means we do compromise that skin barrier. So we do have to keep it clean and make sure we don't get any infections after as well. So we are going to do the same thing here. So if you look very closely, come around this way, you can see this tiny lesion here. Now, the patient has told me that's been there for several months, and that also started life as a pimple, which is the exact same history that she gave for the other lesion on the other side. So this is also a little bit of post-inflammatory hyperpigmentation. But we are going to treat with a very short, simple blast of cryo as well. So a very short, sharp burst of cryo just to freeze that area by itself, and we can see the ice on the surface of the skin slowly melting away. Post-operatively, I'll put some plasters on. I want you to keep them on for the next 24 hours just to protect it from any dust and pollen and things like that in the air that could cause issues. Take off the plasters after 24 hours, let it breathe. All you have to do is keep it clean, watch out for any signs of infection, and make sure you do protect it from sun as well. So use a sun cream with some moisturizer as well.
Hi, my name is Mary. I have this sunspot for years actually, and every time I go out I need to conceal it. I happen to know there's a therapy called cryotherapy. Of course, I will come to Royal Wolf Clinic to do it. I saw Dr. Shang's video on Instagram, so I booked a session to get this removed. I'm really looking forward to the result, and I will be documenting this process of healing, and you can see it together with me.
So if you are interested in dealing with certain skin conditions, skin lesions, or skin tags, then book a free consultation with us where one of our therapists will go through the procedure with you, make sure you're suitable, and get you on the path to recovery.